Hello, hi, good evening, everybody.
Hello, Dr. Ting.
Hi, Irene.
Hi.
Nice to meet you again.
Nice to meet you. So, Dr. Ting, am I right as a layman to say that the heart is the most important function of the entire body? The main engine
Well, as
of
a
your sports car like that.
okay. Well, as a cardiologist, I'm very biased, so definitely I would say that the heart is a very important organ.
You mean it's
Certainly,
not
all
medically proven, huh?
certainly all the normal functioning of all your other organs would depend on the heart, and
Yes.
yes, and obviously we use the heart as a gauge to whether a person is alive or not. So it is a very important organ, and it's something that we really want to protect and keep healthy as we age along gracefully.
Why is it that people say that men had higher risk of heart attack because we like to keep things inside, whereas women, we are more emotive. We scream, shout, cry. I tell you already, you cannot do this. You know, like mothers and wives, you cannot put your shoe here. Women express more. Is it a myth, or it really is that women had a lower chance because we are more expressive of what our heart feels?
No, actually, it is a myth that heart disease.
It's a myth,
yeah, it's a myth that it affects men more. What is true is that it does affect men a little bit at a younger age because the female hormone tends to be protective. It does protect the heart from heart disease. So heart disease tends to come on a little bit later in women, particularly after menopause. So because of that, there's a misconception that women tend to have less heart disease, but the opposite is true. It is still a top killer in women as it is in men. And the problem is women tend to do worse if they develop heart disease. And there's a few reasons for that. One is, of course, because they are, I always like to think, and I always tell people that women are more, they can take hardship better than men. So because they manage the home, then they still have to work, then they have to manage the children.
Multitask and multi-field.
Correct. So very often when they have discomfort, they just shrug it off because they just say, I need to get on with it. So many things for me to do. So very often they tend to ignore the signs and symptoms. So they tend to present a bit later compared to men. They also, and being women, their bodies are a bit different, so their heart, the blood vessels tend to be smaller also. And the type of disease they have is also very different from men. It can be more extensive, can involve the smaller vessels. So they do tend to do worse. So I know in general, women tend to be very concerned about breast cancer. It's always talked about, and rightly so, they should be. But at the same time, they should also be worried about their heart health because it affects them just the same as men, and if not more. So the heart is a very important organ, as we already alluded to, and thus it is in our best interest to keep it pumping well all the time, not only for long lifespan, but also good quality of life. But the hard truth is that many people are at risk of heart disease in this modern day and age. In Singapore, every day 15 people die from cardiovascular diseases, and it still remains one of the leading causes of deaths in Singapore. We're seeing more and more young people also develop heart disease. In fact, just recently, I've seen patients in their 30s who have very significant or severe coronary artery disease or blockage in their heart arteries. The other very worrying trend is that very often before a heart attack, there may be no symptoms or just very subtle symptoms. Many of heart attack victims, when they have their first attack, were actually unaware that they were at risk of developing heart disease in the first place, and hence no preventive measures were taken. As I mentioned earlier, women share the same risk as men and do worse after a heart attack. Symptoms are also more unusual in women and more likely to be missed. So for example, instead of having typical chest pain or discomfort, they may just feel a little bit fatigued or have palpitations or feel a little bit breathless. But there are 9 reversible factors that if a person can completely optimize or improve, we can prevent about 90% of heart attacks. That means cardiologists like me would be out of business if everybody would be able to adopt all these 9 factors well. So high cholesterol is one, tobacco smoking, a lack of exercise or inadequate exercise, stress or too much stress or being very affected by the stress, high blood pressure or hypertension, being overweight, in particular having that excess weight around the tummy, poor nutrition. And I'll talk a little bit more about these risk factors in the second half of the talk. Having diabetes is a really bad thing to have because it really ages the blood vessels very quickly. And alcohol, when I put alcohol in, it means alcohol in excess. So a little bit of alcohol can be protective, but once you overdo it on the alcohol, it can start to harm a lot of organs, including the heart. So I'd like to introduce to people the term of lifestyle medicine. This is not a term I made up. It's an official term, and it's an official specialty in America and in some of the other European countries. It's the therapeutic use of evidence-based, so it's scientifically proven lifestyle interventions to treat and prevent lifestyle-related diseases. So it's not just about simply knowing what to do, but also being able to develop the life skills and the habits to do it effectively.
Because for us, we think we are South Asian because we are Southeast Asian.
Yeah, so in better clarify myself, the Indians have slightly higher risk. Yes.
Okay, and we have a question from Vasan. He said that I have a low HDL in my blood test regularly. There's no medication for it. So what is your suggestion, doctor?
Okay, so HDL is very genetic as well. So unfortunately, that is right. There's no good medication. They've tried. The scientists did try to come up with medications for HDL, but they don't work very well. So at this point, there still isn't any. So the only ways to raise HDL is through exercise. It can be increased by more exercise. Losing weight actually may improve the HDL, or cutting down on cigarettes may also help. In terms of foods, foods that are high in omega-3, such as fish oils, flaxseed, or certain these foods that are higher in omega-3 does also increase the HDL. I usually don't like to promote this, but yes, alcohol in moderation can also increase the HDL. But there's always a danger of going a bit overboard. So I don't promote that as the first thing
choice.
To try.
Not your first choice of remedy.
Yes. Yeah. So if you do take
some
alcohol,
everybody is going to take it. Oh, my doctor said drink alcohol.
Yes.
Drink more.
Yeah.
What is the relationship between heart rate and blood pressure? Is heart rate more important or blood pressure more important?
Okay, I would say conventional teaching is that blood pressure is more important. The blood pressure is what but they're both important, I would say. But blood pressure has, from studies, have a very direct correlation with heart health as well as a lot of the organ health. That's because if you look at it this way, your body is like a machine. There's pressure inside it. If the pressure is very high, you always see the pressure gauge always going to red, right? For those machines. If the pressure is very high, it's going to damage your organs. It's going to damage the machine parts because it's always exposed to high blood pressure. So you do want to ensure that you have, in general, a good average blood pressure so that you give your body, relax the body and don't stress the organs out so much. Similarly, for the high heart rate, all things equal, a lower heart rate is better than a high heart rate. And we usually see that in people who are fit and athletes.
Well, doctor, could you please share with us any parting advice, just one important parting advice before we release you and let you go on with your work?
Okay, so as we get older, and as we have a very Western culture, it's not going to be uncommon as we get older to find out that we may have some heart artery narrowing or hardening. But the key thing is that you don't need to be don't scare yourself too much. It's a reversible condition. You can start taking necessary steps. You can even reduce your reliance on medication if you can adopt the right lifestyle practices to help that.
Thank you so much, ladies and gentlemen. There you have it, Dr. Peter Ting, and looking forward to seeing you next week with my results from my scans.
Okay.
Thank you.
All right, thank you very much.
For your time. Thank you.